Welcome to another presentation brought to you by Understanding Minds, a clinic specialising in reading, learning and developmental difficulties for children, adolescents and adults, and by Understanding Words, an evidence-based reading intervention for children with reading difficulties and children considered at risk of reading difficulties. Hi, this presentation reports on research conducted by myself and McCadley Wright from Understanding Minds and colleagues at Griffith University. We're interested in investigating whether certain reading interventions could be effective for children who have autism spectrum disorders, in this case Asperger's disorder specifically. But what's the problem? Well, first of all, learning support teachers and teacher aides in learning support or special education settings typically work with complex cases. So they're kids who have multiple developmental disorders or symptoms thereof and behavioural and emotional difficulties. Research studies, on the other hand, that are conducted on reading interventions typically exclude complex cases. It's unclear, therefore, whether a lot of published data actually generalise to real-world settings. So in other words, whether people in real-world settings can assume that the conclusions reached by research studies are actually valid for their particular setting. One particular condition that is prevalent in learning support settings is Asperger's disorder and/or other autism spectrum conditions. Previously thought that ASDs were more associated with hyperlexia, so they were kids who read words really, really well but whose comprehension was poor. But it's now recognised that reading problems occur in these children at about the same rates as in the rest of the population. So perhaps up to 20% of the ASD population will have problems with reading. There's currently no evidence to indicate how to teach students with ASDs to read if they're having difficulties. So we set out to investigate in a single case whether a child with Asperger's and dyslexia or word level reading difficulties would respond to an intervention program that had been shown to work for other children. Our subject was called JK. He was a 9-year-old male with Asperger's syndrome, full-scale IQ of 117. When we first assessed him, his word identification score was in the 18th percentile, so better than just 18% of kids his age. His phonological decoding skills were lower than that, so better than 8% of kids his age. So that's his ability to decode novel words, and spelling in the 5th percentile. So the purpose of the study was to conduct an initial investigation into whether the Understanding Words intervention program is effective for students with ASDs. And the secondary goal was to begin to investigate whether children with ASDs responded to any type of reading intervention. The design of the study, we began with a double baseline. So within that double baseline period of 10 weeks, JK was receiving 3 sessions of learning support with the aim of improving reading skills. So technically that was a baseline in which some treatment was being provided. We measured word identification skills, phonological decoding skills, text reading accuracy and reading comprehension. In the treatment period, of 10 weeks, he received 30 sessions of training for a total of approximately 30 hours, and we then conducted a 9-month follow-up. The treatment program was the Understanding Words program. Okay, so results. These are the results for his word level reading skills. They're the Castles and Coulter word lists, which consists of regular words, irregular words and non-words. So the blue bars represent his regular word reading skills. So you can see here, first baseline, directly after treatment, so after the 10-week treatment period, we've got substantial increase in the amount of words he was able to read, and there continued to be some growth in ability at 9-month follow-up. So he continued to get better after the study. Similarly with irregular word reading, which is a little bit hard to see, you can see here at the beginning of treatment, or from the beginning of treatment to the end of the 10-week treatment, there's some increase in ability, and those results were maintained at 9-month follow-up. Perhaps the most impressive data or result that we've got is that JK had exceptional difficulty decoding novel words at the beginning of the study. So if you gave him a novel word, or perhaps even a nonsense word, he had great difficulty reading it. In just 10 weeks, he made a significant improvement in his ability to read those kinds of words, and that ability continued to grow at 9-month follow-up. That's most important because that was essentially the content of the intervention program. We took those letter sounds that he didn't know, we taught them explicitly to him, and we gave him a substantial amount of practice in using those new letter sounds to decode and spell new words. So that's actually the skill in which we're expecting the most growth, and fortunately that's what we saw. Okay, text reading accuracy and comprehension. It's important to measure these things because even though word level skills are vital for reading, if they don't transfer to the reading of text and to comprehension, they may well be considered useless. We can see here, this is the Neal analysis of reading ability. You can see the growth from pre-treatment through to post-treatment, so that's an improvement over that 10-week period. And again, perhaps most pleasingly, we're getting continued improvement over time. Less impressive gains in comprehension, but remember that the program wasn't treating comprehension, it was a word level program. And this is the curriculum-based measure of non-word reading. So this is actually measuring the letter sounds and reading of words containing those letter sounds that were taught in the program. We can see here, first baseline, he could read about, say, 45 of those particular words. At the second baseline, it was down to about 40. But what that shows is essentially you've got a stable baseline. It also showed that the treatment or the learning support that was being provided over that 10-week baseline wasn't doing much to improve his reading skills. We then got a major improvement over the 10-week period. So he's up to around about 125 words that he could read, significant improvement, and that level was really maintained at 9-month follow-up, which showed that the gains were stable, and he was able to continue to use the skills he'd been taught. So our conclusions. The main ones were that the intervention produced substantial gains in word decoding skills, text reading accuracy, and in reading comprehension. We know that further single case studies and group studies are required, but there seems to be no reason why a program like Understanding Words can't be used with students who have ASD. So we believe that learning support teachers can have confidence, provided they have good relationships with their children, and that's the case for all kids, ASD or not. They can take a program like Understanding Words and use it to deliver effective reading instruction for kids who have autism spectrum conditions.